We called this press conference to announce the fact that we now have the first positive test case in Norwalk for the coronavirus COVID-19. The individual is a 40-year-old male who is quarantining at home now, and we're not able to give out any more information regarding the individual. This is not a surprise. We knew that we would probably, in all likelihood, have a positive test here in the city of Norwalk, and the odds are that we're going to have more. But we wanted to announce this because this is the first that we've had in the city of Norwalk. There are other cases in surrounding towns, and you know that there's been several cases throughout the state of Connecticut. And what I would recommend that you do is to look for the broadcasts and the information being put out by the state of Connecticut, I believe this afternoon, sometime around 3:30 or 4 o'clock. Now, having said that, as you know, this morning I declared a state of civil preparedness emergency in the city of Norwalk. It was not in response to this. It was simply to allow me to have greater authority to implement strategies which I believe would help me protect the citizens of Norwalk to a greater degree. Also, it would allow me to seek any available federal or state funding that might help us in the future. So this should serve as a reminder about the social isolation that we talked about. The health professionals have indicated that social isolation is the most effective way to mitigate the chances of this disease having a community spread. And I'm going to introduce Senator Duff now, who will talk about things that are happening at the state level, who will be followed by our health director, Dina Diamore, and then I'll follow up and close out. And we'll answer any questions that you may have, but keep in mind that we will not be answering any questions relative to the identity of the individual who tested positive today. So Senator Duff.
Thank you, Mayor. Again, as the Mayor said, this is something that we knew was coming, that was going to eventually hit us here in the city of Norwalk as it is in the state of Connecticut. So for anybody who is listening or watching right now, please take this very seriously. This is not the flu. This is a very contagious virus and needs to be treated very seriously. People need to take very good precautions. The common sense ones are washing your hands, staying home if you're sick, using tissues to cough, but more than that, we have got to practice social distancing. We've got to make sure that we are staying away from others right now. So if you are at home, be at home with your family. If you're going to go for a walk, make sure that you are 6 feet away from strangers. We need to also practice common sense when it comes to shopping, that we are not panic shopping, that supplies will come back as well. There's a lot of coordination going on here in the state of Connecticut with the mayor and the governor and others in the administration, legislative leaders. We're all in constant contact with everyone each and every single day. We are treating this as seriously as possible. We need the public's help to do that. We ask for your assistance so that we can contain this the best that we possibly can. One of the best decisions that was made was to close our schools. We need to continue doing that across the state of Connecticut. So again, this is not the first. It will not be the last in the city of Norwalk. We will continue to see more and more cases skyrocket here in the state of Connecticut. So it is imperative that we do everything possible to mitigate this virus from spreading even further through community spread. So please practice social distancing. This is not a snowstorm, this is not a blizzard, this is not a hurricane. This will not be over in just a few days. This is going to take a little bit longer, and we need everybody's patience with this fast-moving virus. I want to thank the mayor for all of his efforts that he's been doing. I want to thank Governor Lamont and his team for all their efforts. And I certainly want to thank our local health directors and those who are assisting them right now during this very difficult time. Working together and using common sense and having a level head will help us get through this very difficult time together. Thank you.
Thank you, Senator Duff. And it's important to understand that we are working together. Your government, your local officials, we're working to do everything we can to make sure that we protect you to the greatest degree possible. But you have to help us. You have to work with us, and you have to adhere to those guidelines that are being presented by the health directors worldwide. When we first became aware of this situation, even before it started to spread locally, we called together our team, my team from the health department, with Senator Duff, other people in the community, the hospital, the Norwalk Public Schools, to sit down and to help us develop the strategies we knew were going to be so important, again, to mitigate and minimize the number of exposures in the city of Norwalk. And we couldn't do this without the help of our local health department. Deanna Diamore, or my health director, has been on top of this, as I said, from the very, very beginning, communicating with the state of Connecticut, gathering all the latest information, keeping us aware of what's going on at any given time. So I'd like to introduce her now and have her make a few comments. Deanna?
Thank you, Mayor Rilling, and thank you, Senator Duff. Just as been said, we knew that COVID-19 would affect Norwalk, and we expect to see more cases. But there are steps that we can all take as a community to slow its spread. And just a reminder again, personal hygiene measures, washing your hands, avoid touching your face, and cleaning surfaces regularly. But right now, we are strongly encouraging that people practice social distancing, taking measures to increase the actual physical distance between people. And as been said before, closing schools, changing employment schedules so that people can work remotely or in split shifts, and also canceling large events, meetings, or gatherings. And so we also want to say thank you to the schools and the universities, the local businesses, the nonprofits, the cultural and faith-based institutions, and others who have taken steps to create this social distance. And we encourage even more of these actions right now. As individuals and families, we must practice these measures as well. So please avoid any activity where even small groups of people are together. Think about this. Think about parties and family visits and events that are going on, time in public places. Think about limiting errands, trying to go at times when fewer people are out. In short, we need to stay at home as much as we can, as much as possible. You know, not everyone can do all these things, and we know that these steps are disruptive. We know they're difficult, and they may seem extreme, but they're essential if we want to slow the spread of this virus. The goal here is to slow the spread, flatten the curve. We want to reduce the number of cases. We want to prevent the healthcare system from being overwhelmed. And we want to protect the most at-risk members of our community from serious illness. And so these steps work best if we do them all together. We've seen so many examples of our community supporting each other, looking out for each other, taking steps to keep each other safe. So thank you for all that you're doing, Norwalkers, and all our partners and our neighbors for all you've done, and we ask you to please keep it up. Please take care of yourselves and your families. Get plenty of rest. Spend time outside when you can. Reach out to your friends, your family, your neighbors. Try to do more phone chats, more video chats. The health department and our partners are working on providing resources and tools to help us all cope and stay healthy while we make these sacrifices for the good of our community. These are challenging times, and this will take time and resilience, but we will get through it together as a community. Thank you.
Thank you, Deanna. As mentioned by all of us, these are uncharted waters. We've never navigated anything like this in the past. But we are learning as we go, and we are taking advantage of the experiences that we have had in the past to draw upon those experiences and make sure we implement the strategies we know will work. And again, it is up to all of us to make sure that we do our part and that we be responsible. So again, I want to thank the citizens of Norwalk, because I know a lot of people have been contacting my office, contacting us through social media, asking the appropriate questions, and we know that people are starting to recognize the seriousness of this situation, and they're going to be doing the things necessary, again, to minimize the spread. So having said that, Lamont, did you want to say anything?
No, I'm okay.
So having said that, we will now try to answer any questions that you may have.
Regarding the person, the first case here in Norwalk, based on this person's contacts, is there reason to believe it's likely he passed it on to a number of other people? The
contact tracing is going on as we speak. The people that need to know that may have come into contact with this individual will. They will be told.
Can you tell us whether or not the person acquired it locally?
We do not know, and we cannot discuss a lot of those things right now relative to this individual.
Is it somebody who interacted with a lot of people?
Again, we can't go into details regarding any identity relative to this individual. Suffice it to say, we have a case, and the person is under quarantine, and there is contact tracing going on.
Did you say they were tested at Norwalk Hospital?
No, we did not say, no. We're not, it was tested at a private lab.
What's the, can you give us an idea what the situation is with testing in general in the city? Perhaps number of tests that have been conducted, anything along those lines?
The state of Connecticut is updating the number of tests that are being conducted statewide daily, so the information on the number of tests is available through the Connecticut Department of Public Health.
And that's a good time to remind people that if you feel symptomatic, you have questions, don't appear at the emergency room, don't appear at your doctor's office. You can call 211, you can call our local health department, you can call your doctor's office and tell them your symptoms, and they will determine what the next best steps would be. So please, don't just show up at the emergency room. They can become overwhelmed. It's very challenging right now to make sure that we put out the information, and we put out real-time information, relevant information, but we don't want to create an unnecessary panic. This is a serious situation. But doing the right things, we can make sure that, again, we minimize the spread of this virus. So do all the things that we talk about, and like I said, don't just show up at the emergency room or the doctor's office.
Either of them.
Sorry. As far as the testing goes, maybe I'm behind the times on this, but where can testing be done? I didn't realize it could be done at private labs.
That's something relatively new.
Right, so testing capacity is expanding every day. Hospitals can submit specimens to the state health department, and now doctors can write orders to get the testing done through a private lab.
And that is either at the local level or perhaps more likely at the state level. Is there any thought to expanding the requirements as regarding quarantining, as far as either requiring businesses, restaurants, whatever, to have to close?
I'll ask Senator Duff to comment on that also. We will have, because of the Civil Preparedness Declaration of Emergency, greater authority to do those kinds of things. We want to walk carefully with that. We want to make sure that we do everything we can, but while not shutting down the entire city so that people can't get food, people can't go to church, people can't do other things. We had a conversation, Lamont had a conversation with one of the local clergy asking about having church services. We would encourage people to worship from home and not go to the church services, because a lot of congregations are very closely packed and a lot of congregants. So we want to make sure that they understand that that is not a good way to socially distance themselves.
And perhaps, let me get this in, since Bob, you're going to speak. Is there any thought on the state level to controlling hoarding?
Thank you. And I just want to mention too that, just to your earlier question, Harold, about that we have this positive test from Norwalk. The fact of the matter is that we've probably had people with coronavirus in Norwalk, just as we have in the state of Connecticut, for a while now. This is just the first positive that we have. So this is merely a reminder of what we need to do in order to slow down community spread. And doing the things that we had talked about, such as social distancing, is extremely important. A lot of kids don't have school right now, and so the temptation for kids is to congregate together. They should not be doing that. The temptation is to have play dates, or to bring people together around the table, a small group. They shouldn't be doing that. People should be, they can go outside, they can exercise, they can go walk in a park, but they need to stay away from folks. 6 feet away, I believe, is what's recommended right now. It's not a panic, it's just trying to be smart about it. We want to make sure that we are flattening that curve, as Deanna and we all have been saying for the last 2 weeks. That's extremely important. I mentioned about shopping centers and about shopping and trying to make sure that we don't have the panic buying. Federally, with President Trump's emergency declaration, has changed the rules for truck drivers so they can bring supplies in into our states a little more quickly because the rules are loosened there. But we do need to talk to our constituents and talk to the folks in our communities about not panic buying. Supplies are still being made. We need to have people use common sense. Nobody, for example, nobody needs a case of paper towels. Everybody can use like 1 or 2 or 3 if they need a few extra. But we need to think of our neighbors as well right now. Some of those other questions I'll direct to the state because as you know, the governor has some of those powers to enforce or to change right now. But we're in constant contact. But again, this positive case today is nothing more than a reminder of the things that we need to do in order to keep everybody safe and to keep the community spread down as much as possible.
Any further questions? Well, again, thank you all for, yes?
Really quick, should people, if people think they have it, should they go and get tested or should they stay at home? Is there any?
If you think you have it, doesn't mean that you do. We all sometimes feel a little headache, we all cough, you should call your practitioner, your medical practitioner. Have an interview with that person and they will kind of determine what next steps you need to take. If you feel symptomatic and you feel strongly that you may, then they'll guide you and let you know about the testing process.